Hi, I'm Dr. Michael Sprintz, and today I'm here to talk with you about something that's really important as it relates to medicine these days. So recently, my wife and I went and took a friend to the hospital to get some medical care. And what was amazing for me was seeing the trouble and the struggle that they had in getting the healthcare that they needed in a way of advocacy for themselves. What I wanted to talk about today was how to be your own advocate. And this is really, really important in today's healthcare world. The biggest problem that we have as providers is we don't have enough time. We don't have enough time to spend with you the way that we want to in order to talk about what's going on and get all the information that we need and really listen. And the biggest complaint I've always heard from patients is that, my doctor doesn't listen to me. So what I want to talk about today is how to be your own advocate and how to help improve communication with your provider. In a separate video, I'll talk to providers on how we as providers can really show up for you as a patient. And even though we may not have as much time as we'd like, these are advice and suggestions on how a provider would be able to show up for you as a patient. So today, I'm going to talk for you as a patient on how to be the best advocate for your own healthcare. So the first thing really is about communication. And because we know that a provider doesn't have enough time to spend in the office visit with you. And the reason is because of healthcare and the economics of it, reimbursement continues to go down. Providers have to see more patients per day in order to make revenue and to make sure everyone gets paid. And so they have to shrink the amount of time they can spend per patient. Well, as you shrink you have to see more patients, then you have to shrink the amount of time you spend with each patient, and that cheats everyone. And I, as a provider, and I know that the vast majority of providers, we hate this. It's the reality of the healthcare system right now. So we're trying to make the best of it. So what can you do as a patient when you're going in there? And how can you advocate for yourself and give yourself the best support you can? So the first thing is communication. So when the doctor comes in, honor that you know that they don't have a lot of time. Hey, look, I respect that you don't have a lot of time to spend with me, so I'm going to get to the main point really quickly. And if you'll just listen for a couple seconds or a couple minutes, let me tell you what's going on. And my suggestion at this point, so what that does is that honors so that the doctor or the healthcare provider feels heard. So they're going to pause for a moment and listen because no one's ever told them that before. And then when you go into it, talk about the real reason you're here. What's the number one thing of why you made that appointment with your provider? And that's really important because a lot of times there may be an issue that you're not comfortable with. You didn't really want to talk about it. So you talk about everything else, my kids, my family, this and that, blah, blah, blah. I got this little ache and pain here. I got the sniffles here. And then the doctor's hand is on the door ready to walk out. And you're like, but here's the real reason why I'm here. Here's that itch that I was talking about, or, that burning sensation that I didn't want to tell anyone. Tell that first. Okay. Even if it's uncomfortable, get the main problem out first. And that gives your provider the ability to help you in that time that they have. And then, so after that, the next thing is that if the provider missed it, if they don't really hear you or they're not getting it yet, pause and let them know that. Hey, look, I'm not sure if you understand what I said. Could you say it back to me so we know that we're on the same page? And that allows the provider to explain to you what they believe is the problem that you came there for. And then you can correct them if they're right. Say, yep, that's exactly it. Awesome. And if they're not correct, you can say, well, this is actually why I'm here. It wasn't because of that. It's this. And those little pieces of communication tips help you be your own advocate. Because the worst thing is for you to be with a provider and you get the feeling that they don't hear you and then you don't trust them. And if you don't trust your provider and they're not listening to you, then both of you lose. So hopefully what will happen is just a few little things. And one last point, making the assumption the provider listened, heard you. They paused for a moment and they listened and really heard you. Let them know that. Honor that they listened. Hey, thanks very much for listening and hearing me today. It really made a difference. What that will do is that forms a bond with you and your provider. And I promise you, they will continue to listen to you because you spoke up for yourself. You honored their challenges. You said what you needed. And then you thank them for showing up for you in the way that you needed them to. And I think that is, in the grander scheme of things, if we all could do this, then we would have a much better interaction with our providers as patients. And in another video, I will talk about how providers can show up for you as patients, because we have to show up as well, and it's really important. So thanks very much for watching. I'm Dr. Michael Sprintz. You can find me on Instagram at drsprints.com, and you can email me at michael@drsprints.com. And I also have a website of www.sprintcenter.com and www.drsprints.com. Thanks very much.